Okay, it's trying to go live.
And it's saying it is on my end, Pascal, if that helps you at all.
Yeah, a little bit. So everybody watching, okay, all right, we're ready to go. Okay, we are live, so we're all going to be stars. I forgot to tell you that. I have some producers and directors watching this, so they know they can get us in their next movie. And we don't do porns. But anyway, so welcome. I'm very happy to have another set of on this series of webinars. This is our way of trying to inform people and help people out there. This particular seminar is for people with substance use disorder and how they've been affected by the COVID-19 as well, because COVID-19 brings new dangers and possibilities as well, though. Are we hearing back feed?
Yeah, it's you. We're getting two of you.
Two of me?
Mm-hmm.
Huh. All right, just bear with me. You shouldn't be.
Sound good on our end.
Okay, all right. So again, this is live, so there's no fixing it. And I apologize if there is any glitches, but hopefully you'll get something out of this. So I'm Pascal Fettig. I'm president and CEO of Mental Health America. And I have a group of experts from InWell, which is integrative wellness out of Lebanon, Indiana. But they will take calls worldwide since we're on YouTube. They are great people. They are our go-to when we have referrals for all mental health issues, including substance disorder. And you're going to get to meet the executive director, managing partner of InWell, a good friend of mine. We've worked together for probably a little over 15 years. So we know each other real well. And she is really, as you hear her talking, you'll find out that she is just as equal to her therapist and has a lot of knowledge. So I'm really honored to know her and to work with her. I'm going to let everybody else introduce themselves. So Katie.
Hi there, I'm Katie Pollock. I'm the Senior Vice President at Mental Health America, Boone County. Work a lot with Pascal side by side. We do a lot of the administrative duties at Mental Health, and I also work with survivors of domestic violence on a regular basis to assist them with their needs. Thanks for being here, everybody.
Larry.
I'm Larry Blue. I'm with Integrative Wellness. I'm a licensed addictions counselor, certified in many different specialized areas, including tobacco treatment, gambling, substance abuse, matrix model, Medicaid-assisted treatment. And thanks everybody for being here. And a shout out if you're a first responder or you're a first-line worker, healthcare workers. Thank you so much. You're the heroes of what's going on out there right now. And thanks for being here.
Thank you. Macy?
Hi, I'm Macy Jones. I'm a certified addiction peer recovery coach for Integrative Wellness. I also hold the medication-assisted treatment specialist credential, working alongside people with substance use disorder and removing barriers to get them into treatment.
And thank you very much. Johnny Wilson?
Yeah, hi, my name is Johnny Wilson. I'm a licensed social worker and licensed addictions counselor. And I also have a certification with the state in both peer recovery services as well as medication-assisted treatment.
Thank you very much. And Lynette?
Lynette Clark, the managing member at Integrative Wellness. We serve Boone County and all populations, all ages, pretty much any kind of mental health or addiction needs that you may have. So we do that on an outpatient basis and have many partners within the community that we work closely with.
Okay, well, thank you very much. And it's I'm very happy that you're all on here. And again, I hope that all of you out there watching, if you have any questions, I believe we have the chat room. You can end the questions and answers. Just go ahead and post your questions. If we have time, we'll answer them either as we go or after we wrap up. But if not, we will be giving you our names again at the end of the video. And we'll also provide you with, whoever wants to provide you with email addresses, you can email your questions and I'm sure they'll be happy to answer. So we're going through some trying periods that has created a major scare as far as healthcare, and really has had a dramatic effect on our very core well-beings. And it's obviously affected our economy and our schools and everything we could possibly imagine. And we just were not prepared for this. But we're here to talk to our experts on substance disorders because, as health providers, they're all working hard to make sure that those with substance use disorder still have access to support and treatment, even at a distance. And as we grapple with the effect of this COVID-19, which we still don't know anything about, and this is not only national, it's international, we need to be aware of the possibility that it can have a much greater impact on individuals with substance disorder, especially with some of my questions that I'm going to pose. Like, I'll just go ahead and pose one right now. And again, I'm not an expert on substance, but for individuals that are having issues with opioids and methamphetamines, do those particular drugs not already constrict the blood vessels and so on when we have someone using that substance?
I would say it's hard to me to speak specifically in terms of the restricting of the blood vessels. But what I would say to that question is both the populations that you have identified, those that have an opioid use disorder and or a stimulant use disorder, one of the unfortunate things with that disorder is that oftentimes that population is not very good with keeping up on addressing their health, taking care of themselves, making sure that they're eating nutritionally balanced meals, those kinds of things. And so, I would say that they probably have a greater propensity to acquire some of the COVID-19 due to probably their, just being greater susceptibility to it. Their immune system being down, those kinds of things.
I should clear up my question. The reason I brought it up this way, and I should have went in a little more detail, restricting your blood vessels will contribute to pulmonary damage and pulmonary hypertension. So I guess my question was more, does that make him even more, definitely it should make him more dangerous for if they're still using, based on that this is a respiratory disease. So it's a big concern or it would be a big concern for people who use those particular drugs. There's probably many more out there that do the same thing, but that was my big concern. So that is something that, and correct me if I'm wrong, would make your job even harder, being that, you're kind of dealing with the addictions and the mind aspect of it. And now you've got a patient that you have to not only be concerned about their addictions, but you really have to be worried even more about their physical and medical health. So it is, the point is that all of your jobs is getting so much harder because of this COVID-19 and the unknowns of the COVID-19. What has this caused any of you, and anybody can jump in, to intensify your researches on basically because of the work you're doing? Has it caused you to step up on your researches as far as the impact of the coronavirus on substance use or abuse?
I could comment on that. I think I absolutely have. And I think kind of dovetailing off of the first question you asked, because we saw a good ramp up last year in the fall of, a lot of information about vaping getting out there. And we even saw some movement going on about vaping becoming illegalized. And so anything that's not just meth or opiates that is compromising the pulmonary system is a threat right now. So I've been stressing to people in my groups right now, especially is a good time to quit smoking, because it puts them at a higher risk. You know, any pulmonary strain right now is putting people at a higher risk of contracting the virus.
Okay.
I would say that there's a lot of initiatives coming out of this, and that we've are participating in and trying to be helpful in, because we realize that there's now another layer of implications or barrier to remaining in treatment or seeking treatment. So I think that there'll be a lot more in the next week or two about just kind of some of the things around the state that's going to be going on to help support individuals who are in recovery or who are trying to get into that path. So yes, we're learning and definitely looking into kind of different methods that we can connect with people, serve people, and support them, as well as just being creative on ways to help meet the needs, because there are a lot of different barriers that people who maybe are leaving incarceration or who have a substance use disorder are naturally going to contend with, and they've just amplified by things being closed or by the stress that it imposes on people. So it's a tough disease without the added layer of pandemic.
Just to kind of chime in on what everyone's been talking about, I know it's been a concern of mine, specifically with like how if people with substance use disorder out in active use, from like a harm reduction point, like not necessarily sharing things. I know for me, when I was in active addiction, I wasn't concerned about keeping space from people or, taking those proper precautions. So all those things kind of go to the wayside for an individual who's actively using. So that's definitely been kind of a conversation that I've had with some of my clients that are still, in active use, as far as being safe as possible. And also just like being in the rooms of different anonymous meetings and getting to hear different people share about their struggles. I think one of the biggest struggles I'm hearing right now is the isolation piece. When we're in recovery, we're taught not to isolate, and now we're being told to do the one thing that we have been encouraged not to do. And it's been great to have the online access, and everybody really is ramping up and increasing the access, but that still has the barrier for somebody that doesn't have a phone or doesn't have internet access. So just trying to figure out how to bridge that gap has been on my mind as well.
Okay. Katie, I'm gonna throw you under the bus real quick. Would you have any questions that you want to pose right now at this time?
Well, one of the questions I had, it seems like it probably of a lot of scenarios would in the addictions realm is coming up a lot now for families of addicts and maybe recovered addicts who are all at home right now together. What would you recommend for a family member that might be seeing some of these signs of addiction either creeping back into the life of the addict or are becoming more amplified if the addict was not in recovery prior? And what would you recommend to that family member about how to address that?
So I think there's kind of two things going on there. So I would say one is I think it would be I would definitely suggest to the family member that they were to seek out some type of professional help and or some services. There's a lot of the other 12-step programs that offer specific programs for families that can help them kind of navigate and think through that process. In terms of the individual that may still be actively using or maybe is still abstinent or in recovery, but maybe starting to display some of those maladaptive behaviors again, or starting to see maybe some regression in terms of their thinking or their behaviors. I think, I'm a recovering individual as well. And anecdotally, I'll say like one of the biggest things in my path to recovery has been just people loving me and supporting me, and understanding that it is a complex disease. And so sometimes it's real easy to kind of like want to point the finger or, nobody grows up wanting to be the way that they are for those of us that struggle with a substance use disorder. And so, obviously there's got to be a happy medium between like enabling and such, but I would just encourage the individual to reach out to their family member and love and support. Just ask them, is there anything that I can do to help you during this time? You could maybe get a directory to various 12-step meetings, encourage them to attend some meetings, maybe encourage them to reach out to a behavioral health practice to engage in some services, those kinds of things. So peer recovery services is a really great model that can be utilized for that approach. And we know that there's a real therapeutic value with that peer-to-peer experience. So.
Yeah, I want to add a little something to that. I like what Johnny said about the happy medium, and it's really difficult for most family members to understand if they've been enablers to begin with. And there really is, an important happy medium for people to get to, especially this time with what Macy talked about with isolation. So what I'm seeing happen with people in groups is the frustration that's going on with people in groups and their family members is finding the services that we used to have before the pandemic broke out. So like, for example, here locally, for those maybe that are viewing some other area than the state of Indiana, but for here locally in Indiana, some of the annual recovery meetings that have always taken place, like the oldest known Alcoholics Anonymous meeting in continuation is at Lucille Raines in downtown Indianapolis. And because they've limited that meeting to only the residents, now the folks that come in from the outside don't have those resources. Now, obviously the meeting is continuing like it has for many, many decades, but other places like the recovery homes that have on-site meetings have closed the meetings to outside participants. So it has limited the number of services and number of meetings people can attend. But what I've done is then suggest finding the online meetings, because some of my group is doing online telehealth for the groups, for the matrix groups, IOP with me anyway. So they're getting familiarized with the online process, just like we're doing here today. And so because they're getting familiarized through the services they're already getting with us, I think it lowers their inhibitions about trying it in other places. So then they can try doing an online AA meeting, an online NA meeting. And there are still meetings, again, here locally. I know if you're not in the Indianapolis area, this may sound foreign to you, but in Indianapolis, on the west side of Indianapolis, there's an old Alcoholics Anonymous club called the West Side Club, and it is still open and functioning. So, I just encourage people, and I'll say to them, you worked really hard to use before all this happened, and now you may have to put a little extra effort into your recovery to find some of the services you need to get you through this. Because some of it's not as easily accessible anymore, but I think you can really gauge somebody's motivation about now how hard are they really willing to work to find the things that they know will help them.
Yeah, also to kind of touch on that is that, the clients that I've had that have been hesitant to go to like a 12-step meeting or really get out there with social anxiety or just kind of that fear of something new, possibly having a transportation barrier, the telehealth option has been amazing. I've had several clients have breakthroughs to where they've actually attended meetings for the first time because they're able to kind of sit there. They don't have to share. They don't even have to have their video on. They don't, and they're able to kind of hear how a meeting works and runs, and people support each other to where that could build up their confidence to go once, they are offered more in person. And I know we're offering the telehealth services for our IOP and our medication assisted recovery group that I've been able to get clients to engage in for the first time because of transportation barriers. So now we're seeing an increase in clients actually going and trying out something that's been an objective for them to do because they're able to do it from the comfort of their own home. Granted, that doesn't replace that in-person therapeutic benefit that we get, but I think that it really has increased the possibility of them actually being interested in taking a part of that in their treatment.
So I think my next question is one thing, and I apologize, or maybe I don't need to apologize. I'm always all over the place. So we're kind of going to get this question going back on some of the statements that have been made and some of the statements that we're going to make. So my question would be, if someone is wrestling with addictions, how do you think that the stay home and social distancing advisories affect their treatment plan? Also, kind of combined with that question, since a lot of people are going virtual, and have done a lot more with the virtual meetings, virtual telehealth, and all this. How do you think that is affecting their treatment? Negative, positive, half and half?
I think it depends on the individual and kind of, you know, like Macy spoke to, some people are now actually trying something for the first time because there's a different dynamic to it and a level of comfort. But then some people do have those barriers of not being able to connect or, you know, really missing that face-to-face. So it may not be as impactful for them. But I will say, I kind of hang in there and to keep trying, because it is better than nothing. And I think that the more we can try it out and figure out how to kind of make it work, it's some level of support. So that would be my sense on that, is it's probably really based on the individual person.
Yeah. Yeah, and I fully agree with that. I want to confirm that too. You know, with my IOP groups, there's some people that have commented and said they liked the online option. And I think maybe they're the ones that I've got to kind of rein back in and get focused, because when they do take a turn to say anything, they're like working in their garage with a power tool, or, you know, so it's been a big adjustment for people. And there are some that really like the online option. And then there's some that'll openly say, man, I'll be so glad when this is over so we can come back in person, you know, because they're those type of personal contact people anyway. And, you know, you have those little moments when somebody's dog walks through, or somebody's child has to ask a question, or those types of things. But I think also, you know, there's sort of this relaxed feeling more, and at least it's a connection, at least it's a service, like Lynette said. But there's also this relaxed feeling about it that I think we do need to get to the place where we can get back together again in person at some point, just to really get focused in again together. But yeah, it's a mixed bag. I agree with that completely. And it's very well said that way.
Yeah, hopefully I can remember all my questions. Another question I have, it's one of the things in the years that I've been working, and Lynette and I are constantly working on that, this particular item, and that's access to treatment. For the longest time, you know, and I've been dealing with access to mental health treatment. For me to get access is pretty easy, because I just call Lynette and tell her, could you take care of this for me? But all jokes put aside, I've watched Larry work really hard to get you know, TVs in place and get equipment in place to give him access. So, and I may be way off on this, but the bottom line is, when we have face-to-face meeting, face-to-face one-on-one sessions and all that, you know, if all else fails, people can walk to it. If they know where to go, they can walk there. And we have this social distancing, and we have travel restrictions and stay-home orders. So now they may not be able to access a meeting, and they don't have the equipment. Have you guys seen have you seen or heard of a drop in access? And do you have any, or have you watched any statistics on possibly that's been a concern, that our victims, or not victims, the population that we're trying to assist is lacking access to treatment?
Yes.
I would say, oops, sorry, go ahead, Lynette.
Oh, no, you're good. Go for it.
I was just going to chime in. that I haven't personally encountered somebody that doesn't have a cell phone or internet access, but I know that that is a huge issue right now. I couldn't speak to the actual specifics of like data or research on that. You know, I know that I know how to address that with a client when I have them. You know, I know how to help them apply for, you know, a government assistance cell phone and then wait a few weeks and have that. But really, like, how are they going to get in touch with me to even do that at this point? I will say I kind of called around too, just to see how access is to different behavioral health providers in our area. There is one that's kind of got all behavioral health on hold right now. So they've got about 60 clients backed up that they're not doing any sort of psych or mental health intakes. I know that's not the case for Inwell, and there are places taking intakes, but I know that that I did encounter that. So I can't imagine, you know, how that would feel for somebody to have to wait till potentially, you know, months for this to open up.
Yeah, so I was going to mention for what we have going on, we are offering both in-person and virtual appointments, but we're also, you know, offering if somebody would like to do a virtual appointment, telehealth appointment, and doesn't have their own capability for a device, they come to our office and we connect them. They'll sit in an office by themselves and utilize our equipment to get connected. The challenge is really getting the word out there. If somebody doesn't have that type of information or support, I mean, doing these things are great, but again, you have to have a device to be able to access getting the information. I know that's just going to be a real challenge. I know that we've partnered with some of the folks in the community to get some of those cards out that I know you've passed out, Pascal, with some contact information that's actually like, you know, something that somebody can hold on to. So I know that communities are trying different ways, but I do worry about the people that we don't have contact, you know, haven't been able to contact us. We don't know that they haven't been able to contact us. So that's definitely a concern. And so if you know of somebody, if you're watching and know of somebody, I think that's the best thing. It's just to kind of give them that word of mouth in whatever way that you're able to, because they're not going to see these things. And I know on a different meeting Macy was a part of the other day and really just spoke to the population of people who have a substance use disorder, especially an active addiction, like a really good way. But again, they would have to have some sort of access, but to get connected to them is through Facebook or social media, more so than probably any other way of them potentially even seeing, you know, what's available to them. So.
I guess I would just add to that a little bit. So kind of to bring a different perspective. So while there certainly, I'm sure, are a number of marginalized populations that don't have the access or the ability to get engaged in any capacity, I think the state, like I get emails every day about new initiatives and various strategies that are being utilized by the state here in Indiana and various organizations and practices to kind of stretch ourselves now in this time and making sure that people do have access to care and have a route to kind of navigate the needs that they have currently. But to bring another perspective to that, so, you know, we know largely that the abuse of some of these mood and mind altering substances impacts the prefrontal cortex, which deals with decision-making and reasoning and impulsivity. And so, you know, Macy had kind of talked a bit about, you know, the social distancing really being in opposition to what we learn in recovery, that we need others in our lives to support us. But because I think, you know, in early recovery and the impact on that prefrontal cortex, like we're not always making the best decisions for ourselves in early recovery. And I know it's real easy I can say anecdotally, is real easy for me to rationalize or justify or kind of minimize some things. And, I'm seeing a lot of individuals that are relapsing right now because it's real easy to say, well, there's no services available for me. But the reality of it is that there are services. And, oftentimes, in some, kind of delicate challenging of clients and such, I'll remind them to the fact that there was a time in their life when they were willing to go to any length for that next one, right? Whether they had no transportation, no phone, whatever, they were going to make it to Indy to the trap house one way or another to get that next one. And so we need to have that same kind of passion for our recovery. And I think it's important for us as clinicians or peer supports or whatever, to always convey the message that we're there to be supportive, to help them navigate all that, especially in early recovery when they're trying to address some of those, maladaptive behaviors and some of that impairment in their thinking and such. So I think there's another perspective to it as well. But I think all in all, like everybody's making strides with trying to step up to the current challenges.
And I would add that, I haven't seen, to address the question, I haven't seen anybody technologically challenged to be able to get the services. Now, I've had a couple people that have come right out of jail to go get their first phone. And then the differences between the phone carrier service providers, become some little nuances that they have to figure out at first and figure out how to use and then, click into the links to find the meetings. And I've started to, in groups, encourage them to do research outside of the groups, download things like the Narcotics Anonymous app so they can have daily devotional readings available on the phone once they get it, and to try to encourage them to use the phones even more than maybe they used them before. But I've seen little challenges, little technological challenges. I've even had one. Yesterday, I had to go to T-Mobile about the hotspot on my own phone. And it was kind of strange because when I called to address it with the carrier, and I won't say their name again to respect their privacy, but when I called to address it with the carrier, she said, well, I'm going to text you a link and I'm going to send you a phone number to tell you where the nearest office is at, where you can go get that address. And we're just talking, and she was very helpful, and then it wasn't until I got off the phone that I realized that the link wasn't going to do me any good. My hotspot wasn't working. So then I actually had to I pulled into a gas station to ask about the address that she gave me, because we all get kind of dependent on the Google Maps and being able to just click on addresses and click on websites and click on phone numbers and all those things. And so I really got like an eye opener about some of the technological challenges that some of my clients that have come out of jail may have had first learning new phones and new carrier service providers. But, as a few days goes by, they start to figure that out. And I haven't seen anybody not be able to access the services, but I agree with Johnny, the services are out there, and it's about motivation really at this point, on how hard they're willing to work to find the services.
And my concern would be, and hopefully this is not a ridiculous statement, but Johnny, you mentioned that they basically addicts would do anything and everything they could to get their next fix, and that's their motivator. You guys are their motivators to remain sober, and that makes it a little bit harder. So they need to rise that to their best ability to be able to contact their motivator. But you guys have answered a lot of questions with that one question, because I was going to talk about what do you tell the population and so on. But I do want to touch base a little bit on something that was brought up. A lot of you watching, because I know there's a lot of you watching, don't know this, but our core duty is domestic violence, and our concern is that there has been a hike in domestic violence, but the reporting avenues, because it's all about power and control, and the abusers are using the COVID-19 as a tool to further suppress their victims. So there's a lot less reporting that's happening in child abuse as well. So to where it appears that there is no rise in domestic violence. There's actually a tremendous rise in domestic violence. They just can't get to anybody to report. But it could be somewhat similar. Are you guys seeing a rise, or are you hearing of a rise in relapses and an increased abuse in substance during this COVID-19?
Yeah, I absolutely am hearing of a lot more reported relapses, in particular in my own recovering community. Yeah, I would say that, again, like these times are just presenting a lot of challenges with the social isolation. And at the same time, I think it gives a lot of us, the ability to rationalize and kind of lie to ourselves about what we really need for ourselves in this recovery process. So I absolutely am seeing it.
Yeah, and I think Johnny would probably agree with this too, because of, and maybe even Macy as well, but with our access inside some of the jails, we do overhear, indirectly overhear, because we're in there anyway, and hear about the increase, in the domestic violence calls that are going on, the child abuse calls that are getting reported right now. And right now, typically it's those violent crimes that are not getting released into the community, in the attempt, that local governments, state governments are doing in trying to reduce the populations in the facilities down. These new arrests that are violent ones are not getting considered for re-release, which is a good thing. But back to your point, Pascal, we're just not really sure at this point how much of it is really getting reported. I think this is going to be the fallout of the thing we're going to all, as professionals and clinicians, we're going to be dealing with well into next year, most likely, once this is all over and we start to learn more of what happened in this period of time. I think, unfortunately, we're going to maybe be a bit surprised at the amount that has occurred. So not only I think I've seen an increase occur, but I think it's going to be eye-opening by the end of the year, once we start to learn how severe maybe it's become.
I will say, like, on a positive note with that, in whatever light it can be positive, is that I myself have actually, just through the grapevine and social media, seen people spreading the word as far as that being something we need to bring to light throughout the community and the public, and not just treatment and service providers, is that every single person in the state of Indiana or the country is a mandated reporter. If you see something that is suspicious, or someone that seems like they're in trouble, like, go ahead and call this number. And I've seen numbers posted for counties of place of contact for people. And so that was hopeful in such a dark and very unfortunate, scenario that we're in right now, is that I feel like that is being communicated fairly well. And I feel like if we kind of continue to place ads out there and just kind of tell each other, spread the word that this is an issue and it's happening, and everybody's responsible to say something if they see something.
My next statement, and we're all in the same town, so you guys can throw rocks at me later, and you don't have to say. I don't think I'm outing anybody, and you don't have to answer if you don't feel like it. But I think it's important for our viewers to hear this, if nothing else, to give them hope and to tell them that it's not just hard for them. A lot of us on this panel are in, and I may not use the right terminology, so correct me, but we are in recovery. We are in a high state of sobriety. And I know you guys are using that expertise to help others and to grow in your own lives. But are we worried about our own health, and how hard has this been on our own health? And what are you doing for yourselves?
I think I'd like to comment on that. First, the matrix model that I use for groups and have really believed in since 2009. I want to, again, those of you here locally know the work that Johnny did on trying to get the matrix into the jail, and I am still so grateful for him having that vision to want to push the jail here to have the matrix model, because I've believed in it since 2009. And they teach something called thought stopping techniques. And these are things I do. Okay. So like, for example, I kind of, what I'm getting at is I practice what I preach with my clients, because I'm in recovery as well. And there's a thought stopping technique called snapping, which you can do with a bracelet on your wrist by taking your finger inside the bracelet. If you're feeling anxiety, frustrated, you're feeling like you have a trigger going on, and that's called snapping. It's a positive item identification exercise. And the way I do mine for myself is a token that I wear on my key ring. And so for many years, I've done this, and I will, if I'm getting anxiety or any triggers, then, and this is in my pocket, I can reach into my pocket and even just rub it with my thumb. Now, my first couple of tokens 18 years ago, when I first got sober, I did that so often that I rubbed the letters all the way off at the tokens. So I do actually, I actually practice what I preach. But then to go on, the other thought stopping techniques are to call someone. So if you've gotten a call list from a meeting, that's very helpful. Or call your recovery coach, which is very effective. Call your therapist, call your group. So call someone. And then prayer and meditation is another one. And then I really stress to people, because the matrix model uses prayer and meditation, mindful meditation techniques. There are free apps you can download to your phone for mindful meditation techniques. And these are all things I do. These are all things that I practice and do myself. So my perspective comes from somebody that actually uses the things that I teach to other people, and I can say to them how effective they are. And so that's helping me with my own struggles with isolation. And, I'm just trying to make, and, another one of the thought stopping techniques is exercise. So I'm trying to make sure I'm maintaining, a regular exercise regimen and routine for myself. There's been nice weather. I'm out riding my bike more than I would have, I'm walking my dog more than I would have. So, I guess I'm just trying to keep in mind that all the things I tell other people do actually work for me too.
Anybody else want to jump in on that?
I will. So I guess let me say, first, I appreciate the question. And so with that being said, I'm gonna allow myself to get a little vulnerable here. I am a recovering individual, and what you're talking about is self-care ultimately. And for people in the helping professions, we know it's extremely important to be mindful of practicing self-care. Sometimes we get compassion fatigue or kind of burnout from working with the populations that we do. And so then also to bring about that rationalization piece that I talked on. So even though I'm coming up on 8 years of recovery, I still have my own challenges individually, as we all do, right? Whether we're in recovery or not. And so, this has been certainly hard for me, in the fact that my self-care comes by way of the gym. And so I haven't been able to access the gym. And so it's been very perplexing for me. And, I'm a big 12-step guy. That's been very limited for me. But at the same time, I'll come back around and say that number one, recovery is possible. If we don't ever want to use again, we don't have to. And I know it's not that easy. We don't have light switches on our head that we can just turn on and turn off. But if we're motivated and we're seeking out that help and that guidance and that direction from others in our lives that are going to support us and love us until we can learn to love ourselves, we can get through that recovery. So my issues or contentions today, given these circumstances that are kind of impeding upon my own recovery, they're not issues and circumstances that are telling Johnny that the answer is using, right? And one of the reasons why is because, much like Larry said, I'm able to practice some of the things in my life today that I try to work on with my clients, some of those coping skills and various things, being able to identify, is this a rational thought or an irrational thought, and kind of reframing those things. But yeah, I've could certainly use some improvement in my own recovery today. So I appreciate that.
All right. Katie, do you have any other questions?
One other question I had written down that probably dovetails a little bit off of some other things we've talked about, but I'll ask it anyway. And if there's any new insights people can share, but have you seen, due to the stress of what's been going on these last few months with your clients, related issues crop up for them as well, such as, I'm just going to throw a few out, homelessness, such as self-harm, such as other concerns and issues that might be interrelated with their addiction or the stress they feel from trying to manage that addiction. Is that something you're hearing about out there or seeing with your own clients?
I think just in terms of the, working a lot with those that are involved in the criminal justice system, there's always a significant amount of homelessness for those that are coming out. And I think one of the unfortunate things right now, given our circumstances, is a lot of places aren't accepting people into the transitional living programs and such. And so, that presents a whole new layer of challenges. And, just because an individual doesn't have a place to stay, they're not going to continue to house you in the Boone County Jail and provide you with meals and shelter and such. So those are really big challenges, I think. In terms of the self-harm behaviors, rarely does addiction stand alone. So oftentimes these individuals have some co-occurring issues that are going on. And so again, just as it can be complex for, navigating your recovery process with your substance use disorders, it also kind of exacerbates some of those underlying mental health conditions and such. So yeah, I just think like all around, it's just our circumstances are complicating everything. But I do believe that everybody is trying to step up to the challenge and meet the needs.
Yeah, I agree. And Katie, to respond also, I have seen some clients get challenged with housing since they got out of jail and started to come to their groups in the community. But the ones that have gotten challenged, because as Johnny mentioned, I think I mentioned it too, that some of the places that have public meetings, but because they're housing people, they no longer have the public meetings available. And he's right, Johnny's right, most of them are not accepting new people right now either. So it does create this whole new layer of challenges. But what I've seen happen with some of the people coming to group is about the time, because I've had a couple that have come right out of the jail, gone right to a hotel, and they know right about the time they're going to be getting asked to leave the hotel. And somebody in the community has been stepping up. And so it's been interesting to see like some of the local unspoken heroes too that's happening within the community that are helping out some of the people. I've got a client that was asked to leave a hotel, and now she's staying with a 78-year-old woman in the area. There's another client. She talked with the hotel manager. She's got 2 kids also with her, so 2 of her children are with her. She talked to the hotel manager. She had a job before the pandemic broke out that, there's a promise that she can return to the position. So, she's talked with the hotel manager. The hotel manager is giving her some grace now to continue to stay. She's also looking at other employment because even though there's like this shift happening between some of the restaurant workers and people that lost their jobs, because all the big major retailers and Amazon and Walmart and Kroger and all of them are hiring. So there's like this little fluctuation happening right now from people that were counting on coming out of jail and going back to their job as a cook or, working at Wendy's or wherever. And now they don't have those jobs anymore. And so they're looking for jobs with Amazon and with Walmart and with Kroger, and they're finding them. They're getting them. So maybe it's not the job or the career they wanted to return to, but now there's this big increase in the other jobs that are available. And so then, they can obtain the job and then work on the housing piece as well. So I hope that answered some of your question.
Thank you. We've got time for a few more questions. And like we just did a webinar on, and we got a photobomb. We got a webinar. We did a webinar on domestic violence, and we determined that we could go on. So we're probably going to have another one. I'm going to have to say the same thing about this webinar in regards to not even just substance disorder as a whole. I think it'd be great if we jump back in at a later date and expanded this discussion. But two questions that I have. One of them is I feel that individuals that have been suffering of substance disorder, it's hard for them to get back into a normal lifestyle, if you will. It's hard for them to get jobs, housing, especially if they've been incarcerated and so on. Are we concerned that they're going to be even more discriminated against as the rise in COVID-19 cases takes place and adds a burden to the healthcare system?
I hadn't really thought about that because I feel like we've been doing all this work leading up to the pandemic on breaking down that stigma. And I feel like in our communities, we've been doing a fairly good job at that as far as coming together. There's still a lot of work to be done there. But I hadn't really thought about it as, maybe shifting backwards in that sense, that people might be intimidated by someone that's been careless or not making the best decisions as far as their health goes. So that's definitely a possibility. But I do believe in our communities too, and Indiana as a whole is just kind of working together to break down those stigma and stereotypes against people with substance use disorder.
I think you're right. Now there's been a lot of work done to get this mental health issue, substance disorder issues on the forefront. My fear, and it always has been, that every time something occurs, then all of a sudden something, the stigma issues and everything else start falling backwards. And it is a concern of mine. I see it happening with just mental health, and I fear that it is and will happen with mental health and substance disorders. Hopefully we can get past that. I will say that our state is working really hard. Our governor is really working really hard to keep it up front. All of our health departments are, but nevertheless, it is something that I think we as advocates cannot stop talking and making sure that it stays out in the forefront. My last question will be, and it's a big concern of mine in domestic violence cases, and I fear it would be in substance disorder cases. Have you seen, or do you fear that we're going to see a hike in suicidal, definitely suicidal ideation, suicidal cases that actually succeed, or conscientious ODs based on the hard times with the isolation and the social distancing and the shut-in orders? Is that something that we've seen or that we fear may take place?
Well, we had one Saturday. We had an overdose in the Lebanon community Saturday. That from what I understand from some of the folks in the recovery community was this isolation and the guy being left alone too much. And so I don't know if it's an increase, but we did just have one past last Saturday.
Yeah, I mean, I've had more reports or requests for help as a result of the isolation. Some of them are youth, some adults, and specifically related to this pandemic. So I would say that, like Larry said, it may not be an increase in the actual numbers right now, but the reason behind it is a different reason now. And so I do think that it will become increasingly challenging as some people have lost employment and may not have a job to go back to, and different things like that. Bills will become due eventually. And if people don't have jobs, that's going to just increase their stress. So I do think it's going to be a challenge and something that we're going to see more and more of, unfortunately.
Yeah, I'll just add that I think along the lines of what Lynette was saying, like even after we're back to some type of a a little bit of normalcy within our community. I think in the helping professions, we're going to see the ramifications and the ripple effect of this for some time yet to come as things, people and society tries to collect themselves and get back to life as usual, if you will.
Okay. Well, we are about to wrap this up, so I want to go back on a couple of things. And Johnny mentioned it that there's a lot of accessible information if you're in need of treatment. I know that the state of Indiana, if you're in Indiana, our FSSA, and Lynette, correct me if I don't have it quite correct, but they came out with a great site that I think is going to be here to stay, but it's coming out at a good time. I believe it's Be Well Indiana. And that has a tremendous amount of information, not just for COVID, a lot about COVID-19 related, but on substance disorder, mental health, where you can get assistance for food, rent assistance, and so on. So I've not gone through the whole thing. It's just so full of information, so you can access it. And then, of course, we're going to tell you where you can access information about us. But if you're watching out there and you're not in Indiana, I would say, and you guys can jump in, if you need help, first of all, ask, put away your pride, whatever it takes, have the same drive as Johnny said that you had to get your next fix, to stay sober and to get the help you need. If you're not in Indiana and you're out there somewhere, I'm sure that you can call your local hospital, look in the internet. You can find meetings. They're always everywhere. I would imagine that you could call your local health department and they will assist you. I know ours puts out pamphlets, and there's probably a whole lot of information in your bigger communities, but I think it may be even, and I'm not for sure, so don't take my word for it, but it may be even easier to get the help you need in smaller communities because we all know each other. And it happens to be in Boone County, we all collaborate, not just know each other, but at least some of us definitely collaborate considerably, such as InWell and Mental Health America. So I'm going to let our panel let you know who they are, who they work with again, and how to reach them either through their website or social media and emails. And then I'll end it with telling you a little bit more about us. So if anybody wants to give out some information when they want to get some help out there.
Well, I'd say for the the best way to reach us is either through our main line, 765-680-0071, or you can email us at info.inwell.org, and we'll reach back out.
And I will attest to the fact that they're really quick about it. If you want to reach out to Mental Health America of Boone County, you can find us on mhaboonecounty.org. It'll tell you everything that we do. And I believe there is actually a link to InWell as well. You can definitely, and Lynette just put it on the chat to where you can reach them for their information. You can call us at 765-482-3020. If you have any mental health issues or substance disorder issues, we do very well at helping you stabilize, but then we will refer you to InWell. So if you by any chance forget InWell's number, call us, and that's where we're going to refer you to. They are our go-to. They have a lot of talent. And when I say a lot, they have a lot of practitioners. They are very caring. They do great work. And so it is if you're in the state of Indiana, because they don't just cover Boone County. I think, Lynette, you can correct me, but I think we're in Clinton County, Montgomery County, and even if you're not in those counties, including Boone County, her and I have worked in a lot of counties, so I'm sure we can find the information you need if you need help. The key is you need to take care of yourself. You need to stay healthy. If you're in recovery, you've worked hard. Keep working hard. It's a little bit harder, but your counselors, your coaches, your peer now I don't have to write terminology, but the people you work with are there for you. They're not going away. They care even more now. Reach out, call. You know, I hope you don't relapse, but if you relapse, you're not a bad guy. They will still talk to you. They will help you recover. Again, you're in recovery for the rest of your life. So if you did relapse, don't let that deter you from calling him. You need to know better. And if I know some of these guys on the panel, I know they've already told you that. So just reach out, stay healthy. You guys stay healthy. Katie, you want to tell them a little bit about the rest of our social media?
Yes, you can also find Mental Health America Boone County's Facebook page by doing just that, searching for Mental Health America Boone County. We regularly share all kinds of articles about mental health, addiction, all kind of mental health related issues and topics, local community resources, positive quotes, encouragement, a little bit of something different every day. And in fact, Pascal, I was going to say we also shared that earlier today. That link was shared to bewellindiana.org, which is the FSSA resource you were talking about. So that is now on our Facebook page as well. So yeah, that's probably the best social media outlet to follow us on, I would say, at this time.
So again, I'm repeating myself. You need help, reach out. Integrative Wellness in Lebanon covers numerous counties. If you can't find them, find Mental Health America of Boone County, and that's mhaboonecounty.org, and we will lead you to them. The key is you have a long life to live. This COVID-19 will not take us down. Your addictions does not have to let you down. You're looking at people on this panel that have 18 years in recovery, 8 years in recovery. Macy, I'm not sure if you want to.
Almost 5.
Almost 5 years. That's a long time. And I'm recovering from a whole lot of things. And so the point is you can make it, stick with it, stay healthy, stay well, and stay safe.